Now let's visualize the specific antibiotics. Now for the specific antibiotic that is going to kill, we are going to now use still our algorithm in order for you to visualize all of them. So we are going to use the table in order for you to visualize all of them. Now we need to know that what for the specific, the streptococci generally are going to be targeted by the penicillins. Is it clear? For the streptococci, they are going to be targeted by the penicillins. Now, to understand penicillins family, the penicillins are under the beta-lactam. Is it clear? The penicillins are under the beta-lactam. The penicillins are made up of the natural penicillins. Is it clear? They are made up of the natural penicillins. An example of natural penicillins, we have penicillin G. We have penicillin G, which is taken IV. We have penicillin V, which is taken orally, and we have benzaltine penicillin, which is taken still intramuscularly. It's going to be taken after every 4 weeks. Is it clear? So it's taken after every 1 week. Sorry. So it's taken after every 1 week to 4 weeks. That's a very long lifespan. All these penicillin can be used against streptococci. Is it clear? So now the next thing we are going to have, apart from the penicillins, the natural penicillins, you have now the synthetic penicillins. The synthetic penicillins, you have amoxicillin, ampicillin, and all that. Amoxicillin, you have ampicillin, they are synthetic penicillins, and still they can be used against streptococci. So all these streptococci, the group A, the group B streptococci, you can give penicillins. Now you have to know that what the only streptococci that does not respond to penicillin is the group D streptococci, which is the enterococci. The enterococci do not respond to penicillins, but they respond to the gentamicin. Is it clear? The enterococci respond to gentamicin. Is it clear? That is why under your tutorial of the early onset neonatal sepsis, you need to always give gentamicin, and you give gentamicin because among the causes of early onset neonatal sepsis, you have enterococci. Is it clear? And this enterococci is only targeted by gentamicin. Is it clear? The only medication among the streptococci that is going to target the enterococci is the gentamicin. So penicillins do not target enterococci. Now, after visualizing that, Streptococcus pneumonia, galacti, and all that are going to be targeted by all the different penicillins, except they are resistant to them. Now, the next thing after the streptococci, we have now the staphylococci. Now, under the staphylococci, we particularly have the Staphylococcus aureus, which is divided into two: the methicillin-sensitive Staphylococcus aureus and the methicillin-resistant Staphylococcus aureus. Now, we need to know now the antibiotics for Staphylococcus aureus. Is it clear? We need to know that the antibiotic for Staphylococcus aureus, we have the methicillin-sensitive Staphylococcus aureus antibiotics. The methicillin-sensitive Staphylococcus antibiotics are methicillin containing. They contain methicillin. An example, you have cloxacillin. Is it clear? You are going to have cloxacillin. You have oxacillin. Is it clear? And you have fluorocloxacillin. Is it clear? Fluorocloxacillin. Now, peculiarly, the fluorocloxacillin is easily diffusible. That is why it is the best among this oxacillin family. Is it among this methicillin family drugs? Is it clear? The fluorocloxacillin is going to be easily diffusible in tissues, so it can easily penetrate and result to the disruption of the infection. Is it clear? So that is for the specific antibiotic that is going to be used for Staphylococcus aureus and for methicillin-sensitive Staphylococcus aureus. Now, for methicillin-resistant Staphylococcus aureus antibiotics, you instead going to use vancomycin. Is it clear? Vancomycin, and we have also linezolid. Is it clear? You use vancomycin and linezolid. So those are used in the case of methicillin-sensitive Staphylococcus aureus. And the class of medication of vancomycin is a beta-glycopeptide. Is it clear? It is a glycopeptide. Is it clear? Beta glycopeptide. Vancomycin is a class of drug of vancomycin. It is used among the methicillin-resistant Staphylococcus aureus. So among the methicillin-resistant Staphylococcus aureus, we have two major things. We have vancomycin and we have linezolid. So now the next thing after that, we have the specific medication for the gram-positive anaerobes. Now we need to know that what the gram-positive part makes the gram-positive anaerobes. The example of gram-positive anaerobes, we have Clostridium family. Now we need to know that what the gram-positive part makes the Clostridium family to be targeted by penicillins. Is it clear? So if you have a treatment, you want to treat Clostridium tetani, botulinum difficile, and perfringens, you can use penicillins. And the anaerobic aspect of the Clostridium family make it to be treated by metronidazole. And metronidazole is among the class of medication called the nitroimidazole. Is it clear? Among the medication called the nitroimidazoles. Is it clear? So for the Clostridium family, the specific medication is either penicillins or metronidazoles, nitroimidazole, but we best use metronidazole when you want to treat them. Is it clear? So you can use both of them. Now, after visualizing that, you have to visualize now the others. For the Listeria monocytogenes, you need to know that the specific microorganism antibiotic that is going to be used in Listeria monocytogenes is ampicillin. Ampicillin is the specific antibiotic that is going to be used in Listeria monocytogenes. And this is the reason why in Listeria in the cases of early onset neonatal sepsis, we always place ampicillin in the management because that ampicillin is going to target Listeria monocytogene. Is it clear? Now the next thing is after that the gram-positive anaerobes, we have now the gram-negative. For the specific medication of gram-negative, the specific medication is the gram-negative action of this make this gram-negative to be targeted by the third generation cephalosporin and fourth generation cephalosporin, and also to be targeted by the sulfamethoxazole and trimethoprim, which is